Magnesium deficiency occurs when the body doesn't get enough magnesium, a mineral that plays an important role in numerous bodily functions, including muscle and nerve function, energy production, and bone health. Some common symptoms of magnesium deficiency may include muscle cramps or twitching, fatigue, weakness, loss of appetite, nausea, vomiting, and abnormal heart rhythms. In more severe cases, magnesium deficiency can cause seizures, numbness or tingling in the extremities, and personality changes. Magnesium deficiency can occur due to a variety of reasons, such as inadequate dietary intake, alcoholism, malabsorption disorders, or the use of certain medications like diuretics or proton pump inhibitors. If you suspect you have a magnesium deficiency, it's important to speak with your healthcare provider, who can evaluate your symptoms and perform a blood test to determine your magnesium levels. Treatment may involve magnesium supplements, dietary changes, and addressing any underlying health conditions that may be contributing to the deficiency. Magnesium is an essential mineral that plays a critical role in many bodily functions, including muscle and nerve function, blood sugar control, and energy production. Magnesium deficiency can occur due to insufficient dietary intake, certain medical conditions, or medications that interfere with magnesium absorption. Some common symptoms of magnesium deficiency include 1. Muscle weakness and cramps. Yes, muscle weakness and cramps can be a symptom of magnesium deficiency. Magnesium is an important mineral that plays a vital role in many functions in the body, including muscle and nerve function. When there is a deficiency of magnesium in the body, it can lead to muscle weakness and cramps. Magnesium is involved in the regulation of muscle contractions and helps to maintain proper muscle function. It is also important for the proper functioning of the nervous system, which controls muscle movements. Without enough magnesium, the muscles may not function properly, leading to weakness and cramps. If you are experiencing muscle weakness and cramps, it is important to speak with your healthcare provider to determine the cause of your symptoms. If magnesium deficiency is identified as the cause, your healthcare provider may recommend magnesium supplements or changes to your diet to help correct the deficiency. 2. Fatigue and weakness. A deficiency in magnesium can lead to a variety of symptoms, including fatigue and weakness. When magnesium levels are low, the body may not be able to produce enough energy to keep up with its demands. This can result in feelings of fatigue and weakness. Additionally, magnesium is important for muscle function, so a deficiency can cause muscle weakness. 3. Nausea and vomiting. When magnesium levels in the body are low, it can disrupt the function of the gastrointestinal tract, leading to symptoms such as nausea and vomiting. Magnesium deficiency can also cause other digestive symptoms such as bloating, constipation, and abdominal cramps. If you are experiencing symptoms of nausea and vomiting, it is important to consult a healthcare professional for proper diagnosis and treatment. They may recommend dietary changes or magnesium supplements to help alleviate your symptoms. Additionally, it is important to consume a balanced diet that includes magnesium-rich foods such as leafy greens, nuts, seeds, and whole grains to ensure adequate magnesium intake. 4. Loss of appetite. Magnesium deficiency can potentially lead to a loss of appetite, although this is not a common symptom. Magnesium is an essential mineral that plays a critical role in a range of bodily functions, including the metabolism of carbohydrates and fats, the synthesis of proteins, and the regulation of nerve and muscle function. When magnesium levels are low, it can affect the appetite-regulating hormones and neurotransmitters, such as ghrelin, leptin, and serotonin, leading to a decreased desire to eat. In addition, magnesium deficiency can also cause nausea, which can further contribute to a loss of appetite. However, it is important to note that loss of appetite can also be caused by many other factors, including stress, anxiety, depression, certain medications, and underlying health conditions. 5. Abnormal heart rhythms. Magnesium deficiency can be associated with abnormal heart rhythms, also known as arrhythmias. Magnesium is an essential mineral that plays a crucial role in the normal functioning of the heart and cardiovascular system. Low levels of magnesium in the body can lead to an imbalance of electrolytes, including potassium and calcium, which are necessary for proper heart function. This can result in irregular heartbeats, such as premature ventricular contractions, PVCs, atrial fibrillation, AFib, and other arrhythmias. However, it is important to note that while magnesium deficiency can contribute to abnormal heart rhythms, it is not always the underlying cause. Other factors such as underlying heart disease, stress, caffeine or alcohol consumption, and medication side effects can also trigger arrhythmias. If you suspect that you may have a magnesium deficiency or are experiencing abnormal heart rhythms, it is important to consult with a healthcare professional for proper diagnosis and treatment. Magnesium supplements may be recommended, but should only be taken under the guidance of a healthcare provider. 6. Regenerate response. The body's response to magnesium deficiency depends on the severity and duration of the deficiency. Initially, the body tries to maintain normal magnesium levels by reducing the amount of magnesium excreted in the urine and increasing the amount absorbed from the gut. However, if the deficiency persists, the body may start to mobilize magnesium from the bones and tissues to maintain normal blood levels. In some cases, this can lead to a gradual depletion of magnesium stores in the bones and tissues, which can cause a range of symptoms, including muscle weakness and cramps, fatigue, irritability, and abnormal heart rhythms. If the deficiency is severe and prolonged, it can also lead to more serious complications, such as seizures, hypocalcemia, and hypokalemia. To regenerate or restore magnesium levels in the body, it is important to consume magnesium-rich foods, such as green leafy vegetables, nuts, seeds, legumes, and whole grains. In some cases, magnesium supplements may also be necessary to correct a deficiency, but this should always be done under the guidance of a healthcare professional. In severe cases, magnesium may need to be administered intravenously in a hospital setting. 7. Irritability. Yes, irritability can be a symptom of magnesium deficiency. Magnesium is an essential mineral that plays a role in many bodily functions, including the regulation of mood and emotions. When magnesium levels in the body are low, it can lead to changes in mood, including irritability and anxiety. Magnesium deficiency can also cause other neuropsychiatric symptoms, such as depression, confusion, and memory problems. Additionally, low magnesium levels can disrupt the function of the nervous system, leading to symptoms such as muscle twitches and tremors. If you are experiencing symptoms of irritability or other mood changes, it is important to consult a healthcare professional for proper diagnosis and treatment. They may recommend dietary changes or magnesium supplements to help alleviate your symptoms. Additionally, it is important to consume a balanced diet that includes magnesium-rich foods such as leafy greens, nuts, seeds, and whole grains to ensure adequate magnesium intake. 8. Insomnia. Insomnia is a sleep disorder characterized by difficulty falling asleep, staying asleep, or waking up too early and not being able to go back to sleep. Magnesium deficiency has been associated with insomnia, as magnesium plays a crucial role in regulating sleep and relaxation. Magnesium is a mineral that acts as a natural relaxant, helping to calm the nervous system and promote relaxation. It also plays a role in the production of the hormone melatonin, which regulates the sleep-wake cycle. If you suspect that your insomnia may be related to magnesium deficiency, it's important to speak with your healthcare provider. They may recommend testing your magnesium levels and suggest dietary changes or supplementation to increase your magnesium intake. Foods that are high in magnesium include leafy green vegetables, nuts and seeds, whole grains, and fish. In addition to addressing any potential magnesium deficiency, there are other lifestyle changes you can make to improve your sleep hygiene and reduce the symptoms of insomnia. These may include establishing a regular sleep schedule, creating a relaxing bedtime routine, avoiding caffeine and alcohol before bed, and creating a sleep-conducive environment. If your insomnia persists despite making these changes, your healthcare provider may recommend other treatment options, such as medication or therapy. 9. Headaches and migraines. Magnesium deficiency has also been associated with headaches and migraines. Magnesium plays a role in regulating blood vessel constriction and dilation, and a deficiency can cause blood vessels in the brain to constrict, which can trigger migraines and headaches. Research suggests that magnesium supplementation may be an effective treatment for migraines and headaches, particularly for those with low magnesium levels. In fact, some studies have found that magnesium supplementation can reduce the frequency, intensity, and duration of migraines. If you suspect that your headaches or migraines may be related to magnesium deficiency, it's important to speak with your healthcare provider. They may recommend testing your magnesium levels and suggest dietary changes or supplementation to increase your magnesium intake. Foods that are high in magnesium include leafy green vegetables, nuts and seeds, whole grains, and fish. In addition to addressing any potential magnesium deficiency, there are other lifestyle changes you can make to reduce the frequency and severity of headaches and migraines. These may include managing stress, getting enough sleep, avoiding triggers such as certain foods or environmental factors, and using relaxation techniques such as deep breathing or meditation. If your headaches or migraines persist despite making these changes, your healthcare provider may recommend other treatment options, such as medication or therapy. 10. Anxiety and depression. There is some evidence to suggest that magnesium deficiency may be linked to anxiety and depression. Magnesium is an essential mineral that plays a key role in many bodily functions, including the regulation of mood and the nervous system. Studies have shown that people with lower levels of magnesium in their body are more likely to experience symptoms of anxiety and depression. This may be because magnesium helps to regulate the release of stress hormones such as cortisol, which can contribute to anxiety and depression when they are produced in excess. It is important to note that while magnesium deficiency may be a contributing factor to anxiety and depression, it is unlikely to be the sole cause. Other factors such as genetics, environmental factors, and lifestyle choices can also play a role in the development of these conditions. If you are experiencing symptoms of anxiety or depression, it is important to talk to your healthcare provider. They can help you to identify any underlying causes and develop an appropriate treatment plan, which may include magnesium supplementation, therapy, medication, or a combination of these approaches. 11. High blood pressure. There is some evidence to suggest that magnesium deficiency may contribute to high blood pressure, also known as hypertension. Magnesium plays a key role in regulating blood pressure by helping to relax the smooth muscles that line the walls of blood vessels, thereby increasing their diameter and allowing blood to flow more easily. Research suggests that low magnesium levels in the body may lead to an increase in blood pressure, as well as an increased risk of heart disease and stroke. However, it's important to note that magnesium deficiency is just one of many factors that can contribute to high blood pressure, and it may not be the primary cause in every case. If you're concerned about high blood pressure or magnesium deficiency, it's important to speak with a healthcare professional. They can help you determine the best course of action based on your individual needs and health status. In some cases, dietary changes or supplements may be recommended to help address magnesium deficiency or high blood pressure. 12. Difficulty sleeping. Magnesium deficiency has been linked to difficulty sleeping, as magnesium is known to help promote relaxation and sleep. Magnesium is involved in the regulation of the neurotransmitters responsible for promoting sleep, such as melatonin. If you suspect that your difficulty sleeping is related to magnesium deficiency, you may want to consider increasing your magnesium intake. This can be done by consuming magnesium-rich foods such as dark leafy greens, nuts, seeds, whole grains, and fish. You can also take a magnesium supplement, but it's important to speak with your doctor first to determine the appropriate dosage. In addition to increasing your magnesium intake, you may also want to consider implementing good sleep hygiene habits. This includes establishing a regular sleep schedule, creating a relaxing sleep environment, avoiding caffeine and alcohol before bedtime, and limiting screen time in the evening. 13. Tingling or numbness in the hands and feet. Tingling or numbness in the hands and feet can be a symptom of magnesium deficiency. Magnesium is an essential mineral that is involved in many bodily functions, including nerve function and muscle contraction. When the body doesn't get enough magnesium, it can lead to nerve dysfunction, including tingling or numbness in the hands and feet. Other symptoms of magnesium deficiency can include muscle cramps, fatigue, and weakness. If you are experiencing these symptoms, it's important to talk to your doctor. They can perform a blood test to check your magnesium levels and determine if you are deficient. If you are, they may recommend magnesium supplements or dietary changes to help you get the magnesium you need. 14. Osteoporosis. Osteoporosis and magnesium deficiency are two distinct but related conditions. Osteoporosis is a condition where bones become weak and fragile, making them more prone to fractures. Magnesium deficiency, on the other hand, occurs when there is a lack of magnesium in the body, which can lead to a variety of symptoms and health problems. Magnesium is an essential mineral that is required for many bodily functions, including the formation and maintenance of healthy bones. It helps to regulate the levels of calcium in the body, which is essential for bone health. Magnesium deficiency can lead to a decrease in bone density and an increased risk of osteoporosis. There is some evidence to suggest that magnesium supplementation may help to improve bone density and reduce the risk of osteoporosis. However, more research is needed to fully understand the relationship between magnesium and bone health. If you are concerned about osteoporosis or magnesium deficiency, it is important to speak with your healthcare provider. They can help you to determine if you are at risk for these conditions and provide guidance on how to maintain strong bones and adequate magnesium levels. 15. Constipation. Constipation is a common gastrointestinal condition that affects people of all ages. Magnesium deficiency can be a contributing factor to constipation. Magnesium is an essential mineral that plays a crucial role in many bodily functions, including muscle and nerve function, regulation of blood pressure, and the formation of healthy bones and teeth. Magnesium also plays a role in the digestive process by relaxing the muscles in the intestinal wall and increasing water absorption in the colon. When magnesium levels are low, the muscles in the digestive tract may not function properly, leading to constipation. Additionally, low magnesium levels can lead to dehydration, which can also contribute to constipation. If you are experiencing constipation and suspect that magnesium deficiency may be a contributing factor, it is important to speak with your healthcare provider. They can perform tests to determine if you have a magnesium deficiency and recommend appropriate treatments, which may include magnesium supplements, dietary changes, and lifestyle modifications. 16. PMS and menstrual cramps. There is some evidence to suggest that magnesium deficiency may contribute to PMS symptoms and menstrual cramps. Magnesium is an important mineral that plays a role in many bodily functions, including muscle and nerve function, energy production, and bone health. It has also been shown to have a relaxing effect on muscles, which may help to alleviate menstrual cramps. Research has found that women with PMS tend to have lower levels of magnesium in their blood compared to women without PMS. Additionally, studies have shown that taking magnesium supplements may help to reduce the severity of PMS symptoms, including menstrual cramps. However, it's important to note that magnesium deficiency is just one of many factors that can contribute to PMS and menstrual cramps. Other factors, such as hormonal imbalances, stress, and diet, can also play a role. If you're experiencing severe menstrual cramps or other PMS symptoms, it's a good idea to talk to your healthcare provider to determine the underlying cause and develop a treatment plan that's right for you. 17. Headaches. Magnesium deficiency has also been linked to headaches. Magnesium helps to relax blood vessels, and when magnesium levels are low, blood vessels can constrict and cause headaches. To increase your magnesium intake, you can consume magnesium-rich foods such as dark leafy greens, nuts, seeds, whole grains, and fish. You can also take a magnesium supplement, but it's important to speak with your doctor first to determine the appropriate dosage. In addition to increasing your magnesium intake, you may also want to consider other measures to prevent headaches, such as staying hydrated, getting enough sleep, managing stress, avoiding trigger foods or activities, and practicing relaxation techniques. If your headaches are severe or persistent, it's important to speak with your doctor to rule out any underlying medical conditions and determine the best course of treatment. We have come to the end of this video. I hope it was helpful to you. Share with friends and family. Help our channel grow by reaching more people.